Have you ever felt trapped in your own thoughts, overwhelmed by anxiety, or stuck in a cycle of sadness that just won't go away? Maybe you constantly feel on edge, or you experience intrusive thoughts that make daily life difficult. If any of this sounds familiar, you are not alone. OCD, anxiety, and depression affect millions of people worldwide. These conditions can be exhausting and isolating. But here's the good news. There are effective treatments, and you can regain control of your life. In this video, we're breaking down the top causes of these mental health struggles, the best scientifically backed treatment options, and in the end, we have provided the best strategies to handle panic attacks. Stick around, because this information can help you or someone you love. OCD, anxiety, and depression can be interlinked, so it is important to realize what they actually are, and only then we can understand the right treatment options. Obsessive-compulsive disorder, OCD, is not just about being neat or organized. It involves persistent, intrusive thoughts, obsessions, and repetitive behaviors, compulsions, that someone feels they do to ease their anxiety. These behaviors may provide temporary relief, but can severely disrupt daily life. Some people with OCD struggle with checking behaviors, excessive cleaning, or counting rituals, while others may experience distressing, intrusive thoughts they can't control. Whereas anxiety disorders create excessive fear, worry, and nervousness. Anxiety isn't just mental. It can cause physical symptoms like chest tightness, dizziness, and digestive issues. It can make social interactions, work, and even simple daily tasks feel overwhelming. And finally, depression. It isn't just about feeling sad. It's a deep and persistent low mood that affects energy levels, sleep, appetite, and overall outlook on life. People with depression often feel hopeless and struggle to find joy in activities they once loved. Severe depression can even lead to thoughts of self-harm or suicide, which is why seeking help is crucial. Now let's discuss the most common causes behind OCD, anxiety, and depression. 1. Genetics and family history. If mental health disorders run in your family, you may have a higher risk of developing them. 2. Trauma and stressful life events. Childhood trauma, major losses, or ongoing stress can trigger or worsen these conditions. Cognitive and personality factors. Perfectionism, excessive self-criticism, and overthinking can make someone more vulnerable. People who have a strong fear of failure or constantly seek external validation are at higher risk of developing anxiety and depression. Lifestyle and physical health. Poor sleep, lack of exercise, and unhealthy diet can all contribute to worsening symptoms. Chronic illness or hormonal imbalances, like thyroid issues, can also play a role. The good news is that these conditions are treatable. Let's go over the most effective treatment options. 1. Cognitive behavioral therapy, or CBT. This is one of the most powerful forms of therapy. It helps rewire negative thought patterns and develop healthier coping strategies. CBT has been proven effective for OCD, anxiety, and depression. 2. Exposure and response prevention for OCD. A type of CBT specifically for OCD, where patients learn to face their fears without engaging in compulsions. This helps break the cycle of obsessive thoughts and compulsive actions. 3. Medication-selective serotonin. Reuptake inhibitors, also known as SSRIs like Prozac, Zoloft, and Lexapro, can help manage symptoms for many people. Medication should always be discussed with a doctor, and it may take time to find the right dosage and type. 4. Mindfulness and meditation. Practicing deep breathing, progressive muscle relaxation, and guided meditation can significantly reduce stress and anxiety. 5. Healthy lifestyle changes. Regular exercise, balanced nutrition, reducing caffeine and alcohol intake, and getting quality sleep can improve overall mental well-being. 6. Support networks and therapy groups. Talking to a therapist, joining a support group, can make a huge difference in recovery. Now let's discuss how to handle panic attacks. Panic attacks can be terrifying, but they will pass. If you ever find yourself having one, try these techniques. 1. Acknowledge what's happening. Remind yourself that a panic attack is not dangerous. It feels scary, but it won't last forever. 2. Regulate your breathing. Try the 4-7-8 technique. Inhale for 4 seconds, hold for 7, and exhale for 8. This helps activate the body's relaxation response. 3. Use the 5-4-3-2-1 grounding technique. Identify 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. This helps shift focus away from panic. 4. Find a safe and comfortable space. If possible, move to a quiet place where you feel at ease. Accept the feelings, don't fight them. Fighting a panic attack can make it worse. Instead, try to ride it out and focus on slow, steady breathing. And last, repeat a calming phrase like "I am safe." This will pass can provide reassurance. If you're struggling with OCD, anxiety, or depression, please remember, you are not alone. There are people who care about you, and help is available. Healing takes time, but every step forward, no matter how small, is a victory. If you found this video helpful, please give it a thumbs up, share it with someone who might need it, and subscribe for more mental health content. Thanks for watching. Take care of yourself, and remember, you are stronger than you think.